Good morning. Welcome, everyone. I'm Kate Shanks with the Kentucky Chamber. We're going to get started in just a minute. We have a lot of folks signed up for this webinar. It kind of takes a minute for people to come in, and thank you so much for joining us. Again, if you're just now joining us, you are in the right place. You are here for the Kentucky Chamber Vaccine Update webinar. Thanks for joining us. We have several hundred folks signed up today. I know this is a hot topic. It's something that we are very eager to get started on, but we're going to give it just a few more seconds for people to join. All right, well, I'm going to go ahead and get started. Again, good morning. Thank you for being with us. I'm Kate Shanks. I'm Vice President of Public Affairs for the Kentucky Chamber of Commerce. Today, we are talking about all things COVID-19 vaccine. This is a conversation that's been almost a year in the making that we have been really looking forward to holding. We had a similar conversation a few months ago. We get to welcome back David Herring with the Pfizer company that's working on of course, has this great vaccine out. And we have some others that have joined the vaccine discussion recently that are going to be talking a lot about logistics, the role of pharmacies, giving some practical advice to employers on how to encourage your employees to get the vaccine when it's their turn. And of course, we'll be talking about the timing, whose turn it is, when it's going to be your turn, how you can get registered. So you are in the right place to get lots of great information today. This is part of our Restart Kentucky webinar series. We started that back in the spring to educate businesses about all things COVID-19 related. We've had around 30 webinars over the last year and have welcomed experts on numerous topics. You can find information on our website at kychamber.com/restartky. You'll see all the webinars we've done over the past year, resources about healthy at work, in the past when we've had closures and reopenings. And we also have a great new website up at kychamber.com/vaccines to give you more information about what we're going to be talking about today. We link to all the state vaccine websites that Secretary Gray is going to be talking about. I will put those in the chat in a minute. So welcome. Thank you for joining us. We will record this webinar and we'll share it on our website. So if you have to step away or if there's something that you think a colleague needs to see, you can of course share that recording with them. And we will also be taking questions through the chat function. So please be sure to chat with us today if you have questions. And if you've submitted a question when registering, I have those as well. We will do what we can to get through as many questions as possible. And we know that this is a very important topic and there's a lot of questions that we need to get answered. So with that, I want to welcome our panelists today. We have Secretary Jim Gray. Those of you in the transportation world recognize him as Secretary of the Transportation Cabinet. He's been tasked by Governor Beshear to handle the rollout of the vaccine. So welcome, Secretary Gray. We also have his colleague, Bonnie Hackbarth, with us today. She is on the Vaccine Task Force and is also with the Foundation for Healthy Kentucky. So she's kind of on loan helping with that on all things communication related. We're welcoming back David Herring, North American Regional President for Pfizer Vaccines, for an update on the Pfizer vaccine and some of the research, manufacturing, and rollout of that particular vaccine. We also have Deborah Campbell, who's with the Kentucky Hospital Association. She's Vice President of Quality, and she's going to be talking a little bit about what we've learned through the first couple of phases of the vaccine and the rollout. And then we have Russell Harper with CVS Health. He's Mid-America Region State Government Affairs Executive Director for CVS Health. And he's going to be talking a little bit about the role of pharmacies and some of the work that we have done in the long-term care community. So with that, I think we're going to start today with an update from David. I think you got some slides that you would like to share. Great, looks good.
Perfect. All right, I think everybody can see these. Hopefully, all that is working well. Thanks so much for having me back. It's my pleasure to be here and provide some updates. I'll give you a few quick reminders on the program and then go through where we are from distribution. But I want to certainly thank the Kentucky Chamber of Commerce for having me, and certainly I want to commend Secretary Gray and the team for all their work that they're doing in distributing the vaccine. We're in a partnership, of course, all together as we work to really put down this pandemic, and I think we're making great progress, and I'm so pleased, and I'm sure you'll get some more information from the Secretary and his team today as we go through. Just a quick note, just a reminder, it's hard to believe, but the vaccine is still not technically approved by the FDA. It's been authorized under emergency use. So it's for use in individuals 16 years of age and older. I need to make all of our legal folks happy and make sure and remind you how the vaccine has been approved for use, and authorized for use. So you can see more information on the fact sheet at cvdvaccine.com. So I promise I won't go too much back into the research and development side of this. It's hard to believe, but it's actually becoming old news. We all are, I think, familiar with what we've done. I've certainly brought this up before, but just a reminder that the Pfizer-BioNTech collaboration really only started in March of last year. So we're not even a year old. We did have a previous relationship with BioNTech, who provided the underlying technology, the mRNA platform. And we had started a program with them on influenza actually in 2018, and were able to adapt and adopt that work into the COVID work, which has become the COVID vaccine. And really, the vision of that partnership has really played out probably even better than we expected when we entered this in March, combining their biotech underlying technology and Pfizer's end-to-end vaccine capabilities. 170 plus years of research development, working together in clinical development, supply and manufacturing, and distribution. And now that we've gotten through the phase 3 study, I just want to show you again where we were in the program. But as we've gotten through the phase 3 study and gotten the vaccine through to authorization, we've then been able to utilize and really tap into the rest of Pfizer's capability, from manufacturing and distribution to really help move this vaccine forward and get it out. I'll give you some numbers, and they're really staggering for what we've been able to produce and manufacture. Previously, I talked a lot about what we were able to do in terms of the clinical study, and I'll provide a quick update. But you can see on the bottom, right, we started this March 17th, and we got an authorization for the vaccine in December. So it was a busy weekend. The FDA provided the emergency use authorization. ACIP, which is the advisory committee with the CDC, had an emergency meeting over the weekend, provided the recommendation, and we started shipping doses that Monday, December 14th, 15th, somewhere in there. So we're only still, basically coming up on 2 months into the distribution of the vaccine, and really continuing to ramp up production. The phase 3 study was fully enrolled. It does go down now to 12 years of age. The vaccine was authorized for 16 and older. We're looking to factor in and get the 12 to 15-year-old data into the FDA so that they can review it. But really, a broad study, 153 sites, 6 countries. It actually was in 39 states here in the US. So a tremendous accomplishment getting this done. And it's really then provided us information from all of these different countries: Brazil, South Africa. I'm sure many of you have been hearing about the recent variants. So we continue to monitor that. It is a study that will be in place for 2 years. So we'll track participants for 2 years for safety as well as efficacy, to see how the vaccine protection lasts over time. And importantly, we've been very focused on the studies in enrolling a diverse population, knowing that many of these groups were hard hit by the COVID disease, and wanting to make sure they were well represented in the trial. So let's talk a little bit about manufacturing. So we have a tremendous manufacturing network at Pfizer. If you look globally, 28,000 colleagues, and we supply vaccines prior to even COVID in 165 countries. That is predominantly from our pneumococcal pneumonia vaccine, which is used around the world in babies, and here in the US, of course, as well, and also in adults. And so that vaccine has been in place since 2000. and really, like I said, has allowed us to be a global network for vaccine distribution. Biologics, vaccines, sterile injectables, we have a significant business that provides product into hospitals. You can see here the number of colleagues, sites, 11 countries. And I think the other thing I wanted to just highlight is, in a given year, we would typically provide 23 billion doses of medicine and more than 200 million vaccine doses and 1.5 billion sterile units. But we've committed, and our CEO has put out this aspiration to deliver 2 billion doses of COVID globally in 2021. So the manufacturing team is working hard on that. And you can see that's a roughly 10x sort of scale up from what we produce normally. We continue to provide the 200 million doses of our current inline products, and we're doing this on top of that. I heard from our manufacturing folks, we're closing in on having made 200 million doses of COVID. We're closing in on having 100 million doses distributed globally. We distributed 50 million by the end of December between the US and abroad. And so we're really making great progress and great strides on that. And I'll continue to talk a little bit more about distribution. The last numbers I think I saw, we were 35, 36 million, somewhere in there, doses that we've supplied to the US to date from December through this week. So we continue to scale up and move forward. Of course, the intent is to make as many doses as fast as possible and get them around the world. So just a little bit more on the supply status. Again, late breaking news. We announced this morning, and President Biden announced it last night, that we did sign on for 100 million more doses of supply to the US government. So we had 200 million previously. Now with this extra 100, of course, we'll be at 300 million. It's a 2-dose vaccine, but that still would allow us to help protect 150 million Americans. It does, from the news that I've seen too, equal the same amount that the government's getting from Moderna. So between Pfizer and Moderna, 600 million doses able to protect 300 million people, which is just tremendous. And the goal, of course, is to have that all in place by this summertime. So we're working in partnership with, of course, the federal government, the state governments, and all of you to get the vaccine out and into arms as fast as possible. As I mentioned, 50 million doses is what we made globally in 2020, and this aspiration for 2 billion doses worldwide in 2021. We know certainly that people travel and hopefully will continue to travel. And so if we're not able to stamp out the virus around the world, it will continue to flare up and continue to crop up as people continue to move. The state prioritizations, I'm guessing you're very aware of. We were in phase 1. There's phase 1A, B, and C. And if you look across just phase 1 prioritization, that includes 200 million people who are healthcare workers, long-term care residents, and providers, at-risk individuals, essential workers, and people over 65. So a big list in phase 1, 200 million folks that we're working towards, and making good progress as we move through. Pfizer has a bit of a unique shipment and distribution process. We ship direct, so we still use third-party carriers, UPS, FedEx, but versus going through a distributor, all of the product goes direct from Pfizer warehouses in either Wisconsin or Michigan out to the individual locations. We developed a special shipper just for the vaccine. The vaccine has unique characteristics. It is stored very cold, minus 70 degrees Celsius. And so these shippers have dry ice, and they have a special GPS logger in these boxes. So we can track them both from a location standpoint as well as a temperature standpoint, all the way from when they leave our warehouse to they get to the end location. So far, the last numbers I saw is we have vaccine that has arrived at 99.8% in temperature and in the sort of correct quantity. So everything is moving extremely well as it relates to being able to utilize the shippers. We continue to hold training with all of the points of use every day. People can log in and hear how the vaccine is going to arrive, how to store it, how to dilute it, how to administer it, and we continue to provide that support. One thing that we need to all continue to keep in mind is vaccine confidence. I'm actually very pleased to tell you that confidence has increased and improved since this fall. More people are saying in polls that they're willing to get the vaccine now than they were in October or November. We think that's fantastic, right? And we've looked at a few of the areas that impact vaccine confidence. Certainly people have talked about the speed of the development and regulatory process, asking if we've cut corners. We've gone through this and said no, right? We've worked at light speed, but that's not because we skipped steps. We did steps in parallel. We scaled up manufacturing where we typically wouldn't have done that until we had results. And we had a significant partnership from the FDA in particular, who pretty much gave us instant access to all of their folks to help us as we designed the trials, conducted the trials, and reviewed the data. You can see what impacts vaccine confidence. We continue to focus on building trust. You can see from the survey here where people put their trust, and importantly, doctors, nurse, pharmacists are at the top. These are the folks that people trust in getting advice and expertise from. So a little bit surprising to us, the bottom one was celebrities. I always say this probably discounts Oprah, but other than Oprah, the celebrities are not as trusted as these other groups that we're focused on. And so we're working with different coalitions and want to continue to partner with folks to make sure that the right information and transparency gets out there and people trust the vaccine, and then when it's their turn, they're willing to get it. This led to this pledge as well this fall that Pfizer and other companies were instrumental in. It's about transparency, letting the science dictate the process, and making sure that people feel comfortable that we're following the science and the data from the vaccine, not other pathways, and that will give people comfort and confidence in the vaccine. Here are just a few of the links of people and coalitions and outside groups that we've worked with or they've worked with on their own. And you can see just these resources to help as people look for information about the vaccine, and a lot of focus on making sure that we have equitable access and that people, again, have access to the vaccine. So I know we're short on time, but so I went through it relatively quickly. I want to make sure we get to questions, but Kate, I'll turn it back over to you and the panel.
Thank you, David. And one question I have, and we'll do more questions towards the end, is just the continual research on the vaccines. There's a lot of discussion about these variants. This is what viruses do. They mutate. We know that happens with the flu virus, different virus, but still it happens. So your company is continuing to research, correct? As the virus mutates and as we learn more about the virus and our response to the vaccines, you're going to continually have that research aspect to it. Anything more specific about the variants or where we go next?
Yeah, no, it is definitely a question that continues, and the answer is yes. We continue to do research. We continue to follow the variants. We've been doing tests with the variants and taking serology blood from folks who have been vaccinated and seeing what happens with their antibodies. We're in close collaboration with NIH, CDC, FDA on discussing what we would need to do and look at. So far, everything looks great. The vaccine continues to provide protection, but should the virus mutate to a situation where we would need a different vaccine, we are preparing for that, and whether we could make then a different strain of the vaccine. And of course, working with all of these authorities to figure out what that timeline would be and how quickly we could do it. So all those preparations are underway. And yes, the R&D folks continue to work and evaluate and monitor the different variations.
Great, thank you. I know there's a lot of coverage of that in the news, so we're certainly on top of it. And I think what we'll do now is turn it over to Secretary Gray, talk a little bit about specific Kentucky logistics. I do see some questions coming in the chat. I am making note of those. We'll be sure to get to your all's questions as well. But let's, Secretary, let's go ahead and talk a little bit about where we are on distributing the vaccinations.
Okay, Kate, thanks. We'll do it. I've got a couple of slides. I'm gonna relieve everyone of the anxiety of having to go through way too many slides on mine. I'm just gonna do a couple of them, but I appreciate everything that David shared with us just now. But back up before we get to this one, Kate. Why don't you hold? Yeah. Let me talk for a minute, and then we'll go to this one. I'll tell you when. Yeah. Okay. So I first want to start out by saying that I'm grateful for the opportunity to actually do this and participate in this project. When the governor asked me to help, I said, you guys are already doing an outstanding job, and they have been. And Dr. Stack is, the closer I've gotten to work with him, the more remarkable he has been. And the governor is on top of this every single day. He knows as much about it. He knows more about it than I will say. I've been on this for 2.5 weeks now, a little bit more, and I've just been impressed by both of them and the teams that they have assembled. It's very high performance teams. So I wanted to say that out of the gate. Now, David did a nice job of showing the Pfizer development process, and that puts in context some of the things that I wanted to share. One is that, as he described it, it represented a modern medical miracle, developing the vaccines in the period of time that they did. And if you take it then from the time when the vaccine was released, just 8 weeks ago, to where we are today, that represents a modern logistics miracle in the way that I look at it. Coming from the business world, where I was involved in logistics and distribution through the construction industry, I see this project and think how incredibly quick it has materialized in terms of the logistics, the distribution. In fact, UPS leadership has described it as the most significant logistics project in world history. Gives an example of how quickly this is materializing. Now, everyone, of course, who wants the vaccine wants it tomorrow. But where are we? We will have distributed shortly and vaccinated, shots in arms, almost 500,000 unique individuals, Kentuckians, the first vaccine. We will, if we don't pass it this week, we'll pass it. It's because of the weather, and we'll pass it the first of next week. So that itself illustrates how much has been done in effectively about 4 to 5 weeks' time. Where does that put us looking forward? Well, David talked about how Pfizer is dialing up, is increasing its production levels. Moderna is doing the same. And we're also expecting the Johnson & Johnson vaccine to be released soon. So when you put all of these facts together, the increased production capacity, David mentioned, and Pfizer had said earlier that they were going to hit their earlier target by June. I think that was, David, was it 200 million by June, or am I increasing that?
No, we'll definitely, we'll have 200 million by June.
Yeah, and I believe you said that target was moving up to sometime in May, is what I heard a report on. Maybe not, but in any event, you're dialing up production. Moderna is dialing up production. Johnson & Johnson will be coming online. So if we take the 500,000 that have been vaccinated in Kentucky, and you compare that to our goal of 2.5 million Kentuckians to be vaccinated, out of our population of 4.5 million, that 2.5 million, how do we get there? We get there by taking a percentage of vaccine hesitant folks and those under 16 off of our 4.5 million population number. So when you do that, you can see how, if we dial up our allocations, if our allocations are dialed up, from today we're getting 86,000 a week. That includes our federal pharmacies at 13,000. I know I'm giving a lot of numbers out here, but where I'm going with it is this. We went from 55,000 allocations a week 3 weeks ago to next week it being 86,000. If we see those numbers continue to increase with the anticipated production increases like David just explained, then it's likely that we could get to, perhaps not too soon, not too far off, we could get to perhaps 120,000 vaccines allocated to Kentucky a week. If we get there, then that means that we'd be doing 500,000, 480 to 500,000 a month, which tells you that we could get to that 2.5 million vaccinations in the time that David was anticipating, the time that we've heard. And that's sometime in the late spring, early summer. So it's not, at this point in time, even though it's all about supply, 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 we've got the capacity. We've got capacity for 250,000 vaccines a week in Kentucky. But right now, it's all about supply, supply, supply. And we are seeing light on the horizon from just what David talked about. We're seeing that across the board. Okay, now let me go to a slide that tells us where we are in terms of vaccinating our population. That's the US slide, Kate, the one with the whole country on it. The other one. We'll go, if we can go to that one first. Yeah, that's it. That's it. Right. Okay. The reason I put this slide up is this. It shows us where we are vis-a-vis or compared to our neighboring states. You can see that Kentucky is at 10.2% of our population. 10.2% of our population has been vaccinated with the first dose. Okay. Now, West Virginia has been in the news a lot about its effectiveness, and they're at 12.6%. Virginia is just above us by a point, but we're doing better than Ohio, Indiana, Illinois, Missouri, and Tennessee. Now, clearly there are marginal percentages here. It's marginal numbers, but it does tell us, it confirms that we're on the right path. And that's what's reassuring. We are on the right path. And it's been done very, very quickly. Okay, the next slide I want to show you is where we are today. And Kate, if you'll just pull up that other one. Yeah, where we are today. This is the map that was just released, which illustrates all of the original sites. Now, and by the way, the original regional sites are the white dot wrapped in blue with a point, okay? Those are the sites, and there are 34 of those sites. Those are the sites that were principally hospitals around the state that were doing vaccinations 12 days ago. There were 35 of them, okay? Today, including the new regional sites that were announced the week of February the 15th. It's the week of February the 8th, actually, dialing back a little bit. Bottom line on this is we now have 255 sites across the state, including the 4 programs, the state program, the federal pharmacy program, the VA program, and our local health departments. Very important, our local health departments. They're the ones who know their counties. They're the ones who know their vulnerable populations. And they're the ones who are able to execute very quickly. And let me give you a quick example of that. Christian County, Hopkinsville. On Wednesday, when they found out the extent of the weather that was coming in, they had vaccination appointments for Thursday and today, for Thursday and Friday, 700 between the 2 days. And they doubled down, they went after it. They brought all of those 700 folks in and they vaccinated them on Wednesday. And that just illustrates the level of not only competence, but commitment and passion for getting these vaccines into arms today. Okay, let me wrap things up by saying while we're still in a condition or a situation where demand exceeds supply, but it's not going to be too far off till we are in a situation where our supply is actually greater than our demand. And this is where education, this is where we're going to have to double down on education, and you're going to see that across the board. That's part of the project that we've stood up. Why is that? Well, if we dial back and we look at the H1N1 as an example, the vaccination H1N1 in 2010, so roughly 10 years ago, 25% of Kentuckians actually took that vaccine. We are today a little over 10% of our population. But what could happen is complacency could set in. As the number of cases declines, which is what we're seeing today, as the number of cases decline, the interest in getting the vaccine may decline as well. That's what I meant by the complacency setting in. So this is what we have to really fight vigorously, where we have to fight vigorously, and to continue to educate our population, to continue to mask, continue to social distance, because we are not out of the woods. We are not out of the woods yet. We mentioned, Kate, you mentioned that Bonnie was here on the call with me, and I always ask her, Bonnie, what have I forgotten that we really need to talk about?
Well, I think we've done this
site?
enough now. I think we've done this together enough now that you've captured everything I usually add. So Secretary, you've got it. I think, Kate, we could probably go to a couple of questions if you want to do that.
There are some reoccurring questions that we have gotten today on the chat as well as on the registrant questions. So I might hit a couple of them, Secretary, and then we'll get to a couple of our other speakers.
See,
and then we'll
I see a lot of questions about 1C.
Yeah, so I think that's where a lot of the interest is right now. Here's a two-part question. Can businesses register their employees to get shots, and can they get them on site is one question. And is there a requirement to show ID that you meet the requirements of the 1C phase?
Yeah, the simple answer on both is no. In terms of vaccinations on site, let me put it this way. There are 1.2 million people in 1C. That represents roughly half of our total targeted population for the vaccine of 2.5 million. And the only way to get the throughput, the only way to get the population through this system and fairly is through the CDC guidelines, is through the tiered and the tiered levels. So we're going to have to stick with that. There's been a lot of inquiries about on-site vaccinations, but it's really clear that we're not in the business of picking winners here. We're in the business of doing this fairly. Okay.
And
what was the other question?
I'll point out the other question was, I think you answered it, that proof of that you're in.
Yeah, it may accelerate just getting through the registration at a site to have an ID available with you, but it's not required.
And I will share that I did post in the chat our vaccine website, kychamber.com/vaccines, which points to the state pages. It lists all the people who are in 1C, which I don't believe is going to change. I think that list is what it is. It's from previous discussions with you, Secretary. So those of you asking, how do I get so-and-so on the 1C list? The 1C list is complete. It also includes the sign up to be notified when it's your turn to get the vaccine. And it also includes the map on who is delivering the vaccine so that you can actually go and register for a time to get the vaccine. So I think that covers a lot of questions we're seeing in the chat. Go to our vaccine page. And that's how you will notice. You'll sign up to know. Bonnie, correct me if I'm wrong, if you want to hop in here. But that is where the best place to get all that information on registering, and it will be done by individuals, not by companies, correct?
That's right. And we're seeing a lot of questions about when does 1C start? When does 1C start?
Yeah.
The way the phases are created is the people who are most vulnerable to death and to serious complications, age is that factor. Okay, and that is the older you are, the more at risk you are. And so the phases were set up to address those in addition to those frontline workers. So phase 1A and 1B are eligible right now with an emphasis on persons 70 and older, those persons who are at great risk. When we move gradually into phase C, there's going to be an emphasis on people 60 and older first. And so if you are not at high risk with a health condition yourself, we ask you to wait your turn. Let's get the vaccine into the arms of persons who are most at risk for serious health complications, hospitalization, and even death. In terms of the exact date, in fact, some 1Cs in some areas of the state are getting a vaccine now when the sites have a little bit of extra vaccine and they need to achieve that goal of distributing at least 90% of the vaccine in arms that they receive every single week. So they might have a leftover appointment here and there. So you are seeing in some counties 1Cs getting vaccinated. But if you are not currently 70 and older or starting next week 60 and older, we would ask you to wait your turn. And let's get those people who are most at risk of death first. And then in terms of manufacturing, you are frontline essential employees, you are in 1C. But again, the emphasis that we're giving to all of our sites, the direction is to please emphasize those 70 and older through the 15th, and then starting the 15th, add in 60 and older.
Okay, that's really helpful. And let me
you
go
might-
to Deb. Oh, go ahead, Secretary.
Yeah, I was going to say, you probably should move on. It's at 11:40 and Deb is still on stage there.
We want to
Yeah.
get to Deb and Russ, so we will. And for
And
those
Russ
of you that
too,
can,
yeah.
for those of you that can hang on a little past an hour, we'll keep answering some of these questions in the chat too. And if you have to hop off, we certainly understand. So Deb, let's talk a little bit from the perspective of the employer. We're getting a lot of questions about, should I be encouraging my staff? How do I encourage them? In the hospital situation, you all have vaccinated a lot of hospital healthcare workers. What's some of the terminology and some of the tools or strategies you've used to encourage people to get shots?
Well, thanks for having me today. Thanks for asking. There's been a lot of learnings. We've talked about supply and we've talked about accessibility, but if we want to get back opened up, now we have to talk about willingness to get the shot. So as employers, one of the first things that I would say is be visible, be a leader. As soon as you're able to, get your shot and take pictures, put it on your company websites, share that with your employees that you're getting your shot, and talk about any kind of symptoms that you have following your shot. Let's change the terminology to having a reaction to, I had a great response to this vaccine. I had a little bit of whatever symptoms you have, and I'm glad that I had that because that shows that my immune system is responding to the vaccine. That'll help allay a lot of fears. I think the other thing to know is that if your companies are anything like hospitals, you may start out with kind of low acceptance. Hospitals generally started out with around 40% acceptance. Some were lower. But as more people got the vaccine, their coworkers got the vaccine, they saw their supervisors getting the vaccine, and everyone did well, the acceptance began to increase. And most of the hospitals that started low were up into the 70 and 80% now and rising. And in fact, there are many folks who are looking now, as you are, how do I get my shot now? Where do I go? How do I get that? Because they missed their initial opportunity. So don't be surprised if you start slow. Just continue to encourage and educate. Some of the ways that hospitals did that, besides being really visible and recrafting the message around symptoms, is some did gift cards for their cafeteria or for a local McDonald's, whatever organization, that they gave them very small gift cards when they got their shots to encourage them. One hospital just told me recently that they did a drawing every week. Everyone who got their first vaccine went into one drawing, and everybody who got their second vaccine went into another drawing for cash, for $500 actually. And that was actually, a lot of people told them at the hospital that encouraged them to do it. So that chance, we're lottery lovers in Kentucky. So that was another way to encourage folks to do that. And I guess the only other thing that I would say, unless you have more questions for me, Kate, is that we need to really make sure that people understand that even after they have the vaccine, it's really important to continue to mask and social distance and avoid those large groups, because we are not, there's a lot we don't know. I'm sure David would agree with me on this. We like to think and hope that there's no transmissibility after we have vaccines, but we just don't know that yet because we are so new in this process. And so for now, we all have to behave in the way we've learned to behave over these past months and do the things we need to do to protect everyone around us. So that's something that, again, leadership at your organizations can really be out front on, and teaching people that the vaccine has been developed safely. And I just want to say to David's comments really quickly that I've had multiple conversations with people about the pharma industry. Those scientists didn't have to go into pharmaceuticals. They could have done a lot of other things. And most of the folks I know in that area did it because they want to prevent and treat illness. They're very dedicated. They're healthcare heroes as well. So that's a message I also think is really important, particularly in Kentucky, because there's been a lot of distrust. So those would be just my comments. If you have any questions for me, Kate, be glad to take them.
Thank you. And I think that's a really good point, that being vaccinated at this point, you were still required to follow all the safety guidelines with masking and social distancing. And, if you are exposed, you may in the quarantining. So we continue to, I think, do research on that particular part of the role of the vaccine in our body. So that's a good point to raise that. Let me go ahead. Just
one thing I forgot to mention. Another thing that could be role modeled is the patients. I think, Bonnie said, waiting your turn, and the fact that Secretary Gray said we will have enough eventually. I think if leadership also could role model that patience and that understanding that we're doing the most vulnerable populations first, but they're going to get to us, would also be really helpful. So sorry, I forgot to mention that.
No, I keep reminding myself of that, as so many people I know are getting these shots, and I think I'm sometime this summer, but that's okay. So Russ, let's talk a little bit about your all's role, long-term care, as well as what can we expect through our pharmacy chains. And I did get some questions about how do we serve populations that maybe we aren't serving right now, and those more difficult to get to populations. Is that a role for CVS and other pharmacies to take?
Yeah, and thanks, Kate, and Secretary and everybody else on the panel. It's although I've been through a lot of these conversations multiple times, I still learn something new almost every day about what somebody's doing or how they're involved in the process. But just a little bit of information from our small company. We've been putting shots in arms since we started the long-term care program on Friday, December the 18th. When we vaccinated a 91-year-old veteran at the Sandusky Veterans Affairs nursing home up in Northern Ohio. And we haven't stopped other than Christmas Day and New Year's Day since then. So to the Secretary's comment, we'll be on that 60-day mark next Friday. And we will, as a company, have vaccinated almost 5 million individuals by then, which is about 10% of all the vaccines that have been administered. When we started this partnership on the long-term care side back, those discussions began late summer of last year, and really, took on yeoman's work regarding the multitude of the facilities across the country. And so each long-term care facility that qualified was able to choose their pharmacy partner, us, Walgreens, and then there were some other more local regional pharmacy chains that were involved. But we had over 47,000 facilities across the country that chose CVS as their pharmacy partner. And so we've been working with them very closely with the states. And what I can say, just from my experience in Mid-America is, you've seen one COVID pharmacy program, you've seen one COVID pharmacy program, because each state has been uniquely different in regards to how they interpret and some of the modifications that they've made to the different phases. And that because the CDC guidelines were exactly that, they were guidelines. And so the states have made some changes to those unique to their specific situations. But the good thing is the Ohio governor yesterday, and this is, I know, would be a similar statistic in Kentucky, has seen a 77% drop in the number of COVID cases in their long-term care facilities since November. So I'd reached out to Adam Mather this morning, and he said, yes, we're working on that data too. But I guarantee you that's similar to what Kentucky will show, which is awesome. It shows that there's been a lot of great work and collaboration, not just from us, but from the department, from Pfizer, because that's what we're working with in Kentucky, to UPS, to getting us the shots, to the clinics themselves, and then all the individuals in between with McKesson and the supplies, because we have to have the appropriate PPE, the needles, and all of that stuff too. That's part of this process. But just to kind of jump into what's next to your question is, as more vaccines become available, obviously that expands, our ability to reach more into the retail setting. And we're equipped as a company to do approximately 20 to 25 million doses per month across all of our 9,000 plus stores across the country. And you'll see those start to come online, more and more as we continue to work through the different phases of the CDC and how we can partner closer with states. We are doing some retail in Ohio right now. We expect to start that in Kentucky relatively soon. And as the secretary mentioned, we were hopeful that the J&J vaccine will become available after their meeting with the FTC on the 26th of this month, or FDA, sorry. But long story short, and I'll wrap up so you can get to some questions in the last 10 minutes or so. There's two things I would point out is that we do have a resource on our website that's a vaccine hesitancy white paper, and it's available to anyone. So if you as an employer want to download that, and I can send Kate the link for later, but you can use that, and it kind of walks through some of the data that we've heard about hesitancy and employees, and some of the talking points that you could probably use with them to help with the uptake. And then the other thing too is that we do work with employers similar to we did on the COVID testing phases, in regards to helping individuals get back to work. We call it our Return Ready program. And that's where we work closely with employers on, vaccinations, and also, similar to how we set that up for the testing, for the COVID testing back in May and June of last year. So I'll stop there and just kind of allow you to.
That would be great to get those resources from you, Russ. We'll definitely want to share them with this group. A couple of questions I'd like to hit on, Dave, getting one about pregnant women and getting the vaccine. Is that something that's continuing to be part of your research?
Yeah, so we are looking to do specific special population studies, pediatrics, immunocompromised pregnant women. I will see also if we have information. I think the question I saw in chat too is, what about data we have already from people who either got pregnant or were pregnant during the initial trials? I know a lot of states have asked for information. There's conflicting and confusing information for pregnant women. So I'll have to get back to you, Kate. Maybe my team can give you some of the information that we have and provide it, and so that then you can disseminate it. I don't want to provide misinformation here, and so I'll get you the up-to-date info as it relates to pregnant women.
Great, that would be great. And then another question I've gotten from a couple of people: how are we serving, I think this is for you, Secretary and Bonnie, minority and low-income populations? And I saw yesterday the governor announced some strategies on that. You're muted, Secretary.
and the governor, actually Lieutenant Governor announced it yesterday, community action partnerships is Central Kentucky based today. And what they're doing is they are offering free rides to anyone who needs the rides for the horse park and for Ephraim McDowell. There are also, in fact, Dr. Stack says we're going to quit using this terminology, pop-ups, which are very localized sites that are being set up in vulnerable communities, those where our highest population of those vulnerable are located. For example, Norton's is setting up, I believe, Bonnie, what, 4 in Louisville? Is that right?
I know of 2 that have happened so far, and then there are 4 UK mobile pop-up sites.
Right, the 4 UK. And Deb, you were shaking your head because I think you're familiar with those as well. So we think of this, if you will, as, remember again, we're 11 days into setting up some of the bricks and mortar sites and getting the distribution there. And we have been not at all casual about planning for our most vulnerable and the communities, those who are at home, homebound perhaps, okay? I hear often about rural communities where folks just don't want to leave their home county. So this is why the goal of you don't have to drive more than 1 county away. And if you look at the map today, it's showing a very wide population with very few counties that are still remaining without access, literally in the counties. And we're still working on that. Again, it's back to supply, supply, supply.
Great, thank you. A couple other questions we're getting, and I'm responding in the chat, but for the benefit of everyone, Bonnie, people who work in Kentucky but are out of state.
Yes.
And then something about, if you're otherwise healthy, waiting until March, anything you want to comment on there?
So in terms of the residency requirement, each state is allotted a supply of vaccine based on its population. So Kentucky has 1.3% of the nation's population, and so we get 1.3% of the supply being allotted. And so when you have a lot of people coming from another state, it causes issues in terms of us being able to vaccinate our population. So the only exception to Kentucky residents is healthcare workers who live in another state but are providing direct patient care to Kentucky patients. And so we are asking people to bring their ID to show that they're Kentucky residents. If they don't have a driver's license, maybe it's a utility bill or a lease agreement. In terms of when the 1C starts, we're still getting a lot of questions about that. And as you know, some people in 1C are getting their vaccine now, but the priority is really persons right now who are 70 and older. And on Monday, it'll start shifting to 60 and older. And if you are otherwise healthy, we would ask you to wait until March. You are not at the greatest risk of severe complications or even hospitalization and death. And so we would ask you to wait, and let's get those people who really are at greatest risk vaccinated first. Unless your job title, a frontline healthcare worker, or a first responder, or K through 12. Other than that, we would ask you to wait.
Great, thank you. And then Deb, any further comments? You talked about the response of our, when we get these shots and we have this response, and that it's normal on how employers are kind of managing that within their staff. I mean, are you having to sort of balance, maybe suggesting who gets it when, so that, you have a whole team that maybe is experiencing that response?
Yes, when hospitals roll this out, a little bit different circumstance than individuals going to a website, which may spread out the employees in a given area kind of naturally. But in the hospitals, when all of a sudden all the employees were, available or eligible to get the vaccine, what they did is they would say half of the emergency room staff by alphabet, sometimes by shift, whatever, they would divide them up and say, half get it today, and then the other half they would, later in the week. So that because these responses are not lasting a long time. usually like 24 hours. And so you don't have to separate them by a week, but just a couple of days does that. And what they found is they did have a few people that felt ill enough not to work, but most people were not that ill and could work, but they did divide them up. Yes.
That's helpful because you read about these things on social media, and I mean, the vast majority I probably are just maybe some soreness in the arm, which I get with the flu shot every year. I mean, it's, you know, so it's something to be aware of, but
Mostly we heard, you know, like a mild headache or felt tired, but you know, I mean, that's a regular day for me.
I was gonna say, sounds like a day with my kids at home because of a snow day. So that's what I have. Okay, we have just a few more minutes, so we'll hit a couple more. The second shot. So you do get signed up when you get the first shot for the second shot. I saw some questions on that, but that is something that's kind of automatic in the rollout, so you don't have to worry about that. And I do want to reiterate that you can sign up to get notices that it's time for you to get your turn to get the shot on the state page. But then there's also a way that you would sign up to actually get the shot when the time comes based on the facilities on the map, correct?
Yeah, let me explain that. So the website vaccine.ky.gov, which you link to on your site, Kate, is a site where you can go, number one, to find out what phase you're eligible in if you're not quite sure by the job description. And then number two, if you are eligible, it'll show you the map of all sites that are distributing vaccine right now. Keep in mind, supply is far exceeded by demand, so you may not get an appointment right away. But then you also can sign up for notifications. And what those notifications are going to be is, okay, we're now serving 1C 60 and older, or a new site has been opened in your community. So things like that. They will not actually register you in a list, in a waiting list. There is no waiting list at the state level. But once you are eligible, and then you can go to that map and try to find a vaccine that is going to be available for you. Again, this is all going to solve itself in a little bit when the situation we have now sort of reverses. Right now, we have far more demand than supply. In a few months down the road, we're going to have far more supply than demand, and we're really going to have to urge people to get that vaccine so we can reach herd immunity. Herd immunity is 70 to 80% of the population, and we have a vaccine hesitancy rate that greatly exceeds that in many populations. So we are really working now on campaigns to encourage people to take the vaccine, and that's why what Deb says about sharing your good experience is a really good idea. Let people know, yeah, maybe I had some side effects, but that's my body getting a workout, my immune system getting a workout, and I'm a little sore afterwards. But I'm building it up so that I can protect myself from this disease.
Excellent. And you know, we do encourage you to go ahead and start educating your staff. You can share this webinar. You can share our resources. Russ, we did get a request for your resources that if you could share it with us, we'll get it out to this group. So we do think you need to start doing that now. Even if you maybe aren't in 1C, or maybe some of your staff aren't, I think the education is important. On behalf of the Kentucky Chamber, we do believe that the vaccination of Kentuckians and herd immunity is important, of course, for stopping this virus and to truly recover from both the health crisis and the economic crisis. So we are here for you all to help you all navigate this issue. I do agree with Secretary Gray. It's going to reverse itself, and we're going to see a lot more supply. Thank you to David and Pfizer, and of course Moderna, J&J. We look forward to the J&J approval soon in March. So I think this is a great place for us to be in, and we're going to keep making progress on this. And for those of us that need to be a little patient, we will remind ourselves to continue being patient so that we can get people vaccinated in the right order that is best to really stop the deaths and the most severe illness among us. So I do want to thank you all. We are right at an hour. We are getting more questions coming in. I'm going to leave the chat open for a minute if you'd like to sit here and chat with me, and I'll try to answer the questions that I can. But thank you so much to our panelists. Perhaps we can revisit this in a couple of months and see where we're at and what we need to do to educate the public. But thank you all, and everybody stay warm. Yes, sir, Secretary.
Kate, I was just going to say that, Bonnie, I don't know what your schedule is right now. I know we're both going from one thing to another, and we've got something in one. But I don't want to truncate the opportunity for folks to ask questions. I do see some questions that are still coming in. Is there a way you can collect them and for us to get back to them? I think, Bonnie, you and I talked about that. I want to say this too, just in closing, that if we dial back to less than a year ago, when there was a lot of anxiety over testing and folks couldn't get tested, remember? And I've described this period that we're going through as the storm before the calm, where there is anxiety. Everyone wants to get vaccinated tomorrow. And we hear a lot of stories about people going online and not being able to get through, and then they'll be able to get through. When we say patience, when we encourage patience, we're also encouraging persistence and going on the sites, getting on the sites, in fact, is as early as you can, and staying persistent about that, because we will get everyone vaccinated. That's what we can assure everyone of. And it is coming actually sooner than was originally scheduled. And that's confirmed by what David was saying earlier in terms of the production of the vaccines. And then with the capacity we have in Kentucky alone to actually get the vaccines in arms. We've got that capacity. So anyway, I just want to say that's a reassuring part of this. So
Yeah,
thank you, Kate.
Secretary.
Appreciate it.
Thank you so much.
Appreciate
And
it.
thank you to our panelists. I'm going to keep the chat open for a minute and I will copy the chat and we will respond. If we didn't get to your question, I'm sorry, but I will get to you. So thank you all so much.
Kate, I've got about 5 more minutes. I'm happy to answer any other questions that are different from the ones we've received.
All right, Bonnie, let's look at this list.
I do have to drop off, but I'm happy for anyone to contact me, or you can contact me directly if you have questions I'm also an infection preventionist. So if people have more clinical questions, I'd be happy to answer them.
That's right. I should have mentioned that. She's our infection expert.
Bye, everyone. Thank you.
Let's see, Bonnie, what are you seeing here that we want to address? Those age 60 will be given priority with 1C. Is there going to be similar ordering for other classifications? You know, it's my understanding. Go ahead.
Right now, we're looking at prioritizing persons who are older, and that's what we're doing with 1B right now as well. Is we did have a special program to get K through 12 vaccinated, so at some point we can get kids back in school, because there was a lot of concern among teachers and administrators about that, and even parents. But we're gonna focus on age initially in 1C.
And then Russ, you might be able to answer this. Do you all have any best practices, resources for, employers or for individuals on how to navigate this process that you all could share? I know you all do a lot of education through your health initiatives. So
when you say this process, are you talking about enrolling to get vaccinated, or
encouraged for supporting patients and education of staff? If there's anything.
There's some resources in the white page or white paper I talked about earlier, and I'll email you that whole landing page. We have a whole landing page with a lot of resources on it, and then there's specifically the white paper on hesitancy of taking the vaccine. So I mean, it's not the novel of how to the psychology of it all, but I think it's something that's helpful. That employers can look at. And I think there's also some toolkits available on the CDC website, may not be as specific to, what you're asking about, but I think there's also some other things out there that I've seen.
Great. We will get that out, and I will look for those pages as well as sending out our vaccine page.
Kate, I see a couple questions about childcare in 1C.
Okay, go for it.
Yeah, childcare are a priority population. They are in 1C. K through 12 was originally in 1C, and we moved it up in Kentucky to get kids back in school, but it's a large population, and there was a decision, you know, to draw lines where we needed to draw lines so we could still emphasize those persons who are most at risk. Childcare workers are important. They've been with the kids every single day for most of this time. Some childcare centers were closed, but many were not, and we understand that. Children, however, are at the lowest risk for COVID. And so they are 1C, they are a priority, and we'll be starting to look at them, you know, when 1C fully opens. But 1C will not be fully open for quite a while yet. Can't give you an exact date, but I think that that's at least some helpful information about why we came to that decision. There was also a decision about, can employers require proof of vaccination if they give an incentive? I want to step back and answer that question broadly first. There is no plan by the state to require vaccinations, first of all, require COVID vaccinations. I want to make that very, very clear. Every person who gets a vaccination receives a vaccination card that says the date of their vaccination, their name, and the type of vaccination they got right now, whether it was Pfizer or Moderna. And so from the Department of Public Health perspective, I don't see a reason why that couldn't be asked for. That's a question for business law that Kate and her team might be able to answer, but from the Department of Public Health perspective, every person who's vaccinated will receive that proof of vaccination. So there will be something you could ask for.
Yeah, I was thinking that too. And, you know, we have a wellness program at the chamber. And so, you know, I have to submit proof of things like an EOB or a receipt. So I would think that would be a reasonable request. There was a question in here about other states. I don't know, Indiana, Ohio, Russ, if you all, I would imagine that they could go to that state Department of Health website to look for information like what we have in Kentucky.
Yeah, Ohio has sort of a central resource through the Ohio Department of Health, as does Indiana. But again, I mean, like I said, they're really different in regards to what populations that they're focusing on. You know, Ohio's been really specific in their age limits and keeping it to, you know, individuals with some disabilities, and then Indiana has opened it up a little bit broader. So you just kind of have to make sure that you're looking at their guidelines, and Ohio has a lot more points of distribution than some, you know, in Indiana. So.
Okay, and Bonnie, there's a couple questions. So the 1C group that lists sectors,
all those job sectors, right?
I mean, you really just sort of have to use your judgment. I mean, one question I got is, are CPAs part of financial? And then I see in here, are public library staff part of education? There isn't more information out there that describes those sectors than what's on your website, correct?
Use your best judgment. If you are otherwise healthy, please wait and let persons who are at greater risk do that. Wear your mask, keep your social distancing, use your hygiene, work from your home if you can. I know that many people cannot do that, but if you can, you know, try to stay at least 6 feet away from persons who are not living with you in your own household, and use those measures that we've been using that are shown to work, because when we stop using them, the cases go up. But they are broad categories. We recognize that. That's why it's 1.2 million people in 1C. And so we will be asking our sites to prioritize persons who are 60 and older beginning February 15th. I saw another question fly over the screen there. If I'm over 60, then I can start trying to schedule on Monday, right? The answer is, if you're otherwise healthy, please wait. Let people who are at risk, who might have some health conditions, in addition to being 60 or older, to get there first. And again, this situation is going to start resolving itself as supply increases and even more sites are opened.
And how can people follow developing news on the vaccine? You know, the governor, of course, does his press conferences, I think Monday through Thursday at 4. Is there a social media account they can follow? What's the best way to say, hey, all of a sudden this is happening, go sign up?
The best way is, there are two things. Number one, go to the kycovid19.ky.gov website. Every day's numbers are posted there. How many people have been vaccinated? What percentage of the vaccine we've used? How many COVID cases there are? All of that stuff is right on there. And if you click on the gold vaccine bar, that's where you're going to get all of the vaccine information. In addition, on that gold vaccine bar, when you click on it, you'll see the frequently asked questions. And that's something that I work on every week, and we try to update that. And many of the questions on there are the exact questions that you're asking today. And so if you didn't get your question answered today and you need an answer right away, check out that FAQ. We're indexing it now. It's not indexed yet, but you can do a control find when you pull it up to try and find an answer to your question. But that has just a myriad of answers that may be very, very helpful to you. And then sign up for notifications. Again, it is not a statewide waiting list. This is already a complex logistical project with all of the different factors that we have to address. So we don't have a statewide waiting list, but you can get on the notification list when your group is eligible and when a site is open near you.
Great, and thank you. I just posted that website in the chat. You mentioned 60 and over on February 15th. Please prioritize those who are older and have health problems. I think that's the best thing to answer to the question of, am I really in 1C? Well, maybe the question is, can you wait until people who are older maybe have health conditions? I think that might be the question. But those are broad categories and they're on our website. So take a look at that. Legal issues about encouraging people to get the vaccine. I think you're on safe ground providing education. And there are employers that are providing incentives. So I think that is a safe place to be to educate. And should you have incentive programs, you could look at those as well. So I think that's most of the questions. I'm going to go ahead and copy the chat. I know everybody's got to get to some other Zooms today. Happy Friday. Hope everybody stays warm and has a good weekend. Thank you all so much for joining us. We will post this link later today on our Restart page, and we will be in touch. And everyone take care and stay safe. Thank
Thanks,
you
Kate.
all.
Bye, Bonnie.
Thanks. See you all.